This week, European health officials said it was too early for the general population to get that second booster against COVID-19. Here to answer your questions is Dr. Simone Wilds, an infectious disease specialist at South Shore Health. Dr. Wilds, thanks so much for being here. We appreciate it.
Great to see you, Dr. Wilds. Okay, so right now the EU is only going with the additional boosters for adults who are 50, actually 80 and older. The United States is saying that adults 50 and older should be doing that. So what are regulators looking at, or why isn't balanced? Why not recommend the added shot?
Yes, Ed, it's a really important question, and I can understand how it can be confusing looking at the EU and the US. Bottom line is they are looking at data from Israeli with regards to, who should get the second booster shot, and that was given to those over age 60. What you see happening is the EU is taking the more conservative approach and wait and see, while the US is more proactive and giving it to those older than 50 because they want to keep everyone safe. I think they're just trying to make sure they stay ahead of the curve.
Get out ahead of it, right.
Yes.
But so do you see a wider push to make sure people get boosters, or do you even think it will even be necessary?
Marie, it's a really important question. I think as we see more cases increase, what we will find is that there's going to be a greater push for people to get vaccinated, because the key is they want to keep people healthy and well.
So speaking of vaccinated people, we have seen a lot of high-profile COVID cases this week, and 99.99% of them say they are vaccinated. House Speaker Nancy Pelosi has just announced that she tested positive. She said she has been vaccinated. So we've also seen a lot of people mask-free in large group settings. If you've seen any of the golf, for example, at the Masters, you don't see a mask anywhere. Are we jumping the gun a bit here? What's the takeaway?
Well, Ed, I want to say, whether you're high profile or not, one thing is very clear. COVID is still with us. So I think as we see numbers increase, we need to be a little bit more vigilant. And, if we're going places where there's a lot of people, I think you might want to think about wearing your mask, just being a little proactive, because we are seeing an increase in cases right now.
Doctor, I don't want to speak for anybody. I will only speak for myself. But I think a lot of people, I guess I'll only speak for me, we're ready to live with COVID among us, just live our lives. But the virus decides when it's done, obviously, right? Not us. So as you watch all the data coming in, what will it take for you personally? I don't want to speak about anybody else. What will it take for you to roll back your own behavior?
Maria, for me, I totally understand people want to be free. I get it. I do too. But as an infectious disease physician, as a mother with a family, I personally look at the CDC guidelines. I look at what's happening in our local community, if the positivity rate is high or low, and I do look at wastewater. So based on those that information, I use that to judge whether or not I can take my mask on or mask off. Bottom line is, I have to follow the data.
But you admit that we're in a much better place now than we were before.
Absolutely. Okay. Way better, and definitely looking for even better days ahead.
Way better and better even ahead. All right, Dr. Wilds, thank you so much. After two